Dear students, welcome back. In the previous session, we have discussed about the fibula, bony parts of the fibula and its borders and surfaces. Isn't it? Now in this session, we are going to discuss about the attachments of the fibula. As we know that in the anterior aspect of the fibula, we are having two borders, isn't it? So one is the anterior border and another one is the interosseous border. Both are very much closely related actually, isn't it, on the anterior aspect. So, and here the surfaces and also on the posterior aspect you'll have the posterior border. So the surface between this anterior border and the medial border or interosseous border, commonly we can call it as medial surface, isn't it? This surface is medial surface. From anterior to posterior border we'll have the what you call as lateral surface. Okay, and then from medial border to the posterior border we'll have the entire posterior surface. Okay, so that thing I want to give some clarity about this thing again. Yes, so if you see the transverse section, okay, so this one becomes the anterior border, okay, and this becomes the interosseous border or medial border. Okay, and we'll find another one is the posterior border here. Okay, so the surface between the anterior border and the interosseous border is called as anterior surface or medial surface, and the surface between anterior border and the posterior border will get the lateral surface, and the surface which is in between the interosseous border and the posterior border, that surface is called as posterior surface. Okay, and in the posterior surface you'll have a medial crest is present. This crest divides this posterior surface into posterior-medial surface and posterior-lateral surface. Okay, now we will see what are the muscle attachments on these surfaces. Okay, so first we will move on to the medial surface. Yes, this is the medial surface. Here you can see the schematic representation of medial surface. So medial surface is present in between the anterior border and the medial border or interosseous border. So this bone has this surface is divided into 1/4, 2/4 and 1/4. Okay, so here in the middle 2/4 it is divided into again two parts. Okay, two equal halves. Okay, so the medial surface at the middle it is divided into two halves. Okay, in this medial surface you'll have the lateral part and the medial part. Okay, now in these areas what are the muscles which are getting attached? That means this medial surface of the shaft gives origin to the extensor digitorum longus from the whole of the upper 1/4, okay, and from the anterior half of the middle 2/4, isn't it? So the entire 1/4 of the upper shaft and the middle of the 2/4 shaft gives origin to the extensor digitorum longus. Okay, now we will see the another muscle which is extensor hallucis longus. So this one is originating from the posterior half of its middle 2/3. Posterior half of its middle 2/3, 2/4 gives extensor hallucis longus. Okay. And the lower entire 1/4, the lower entire 1/4 gives origin to the peroneus tertius. Okay, so these are the attachments on the medial surface of the fibula. Now we'll move on to the lateral surface now. Yes. So where is the lateral surface? The lateral surface is present in between the anterior border and the posterior border, forms the lateral surface. Normally in this surface, the shaft gives origin to what we can call only two muscles, that is peroneus longus and peroneus brevis. And also this lateral surface, a shaft is also divided into upper 1/3, middle 1/3 and the lower 1/3. Okay, so now the peroneus longus is originating from its entire upper 1/3 and posterior half of the middle 1/3. Okay, so the upper 1/3 of the lateral surface of the shaft and also the posterior part of the middle 1/3. So this gives the posterior peroneus longus muscle origin. And coming to the peroneus brevis, this peroneus brevis will get originating from the anterior half of the middle 1/3 of the shaft and the whole of the lower 1/3. Okay, so normally the common peroneal nerve terminates in relation to the neck of the fibula. Okay, now we will see the head of the fibula receives insertion of the biceps femoris. The head of the fibula receives the insertion of the biceps femoris on the anterolateral slope, of the apex. This insertion is C-shaped. The fibular collateral ligament of the knee joint is attached within this C-shaped area. Okay. Now we will move on to the posterior surface now. Yes. Here comes the posterior surface, and the posterior surface lies between the interosseous border, okay, and then the posterior border. And the middle of this posterior surface, it is having a medial crest, isn't it? Medial crest. And with this medial crest, it divides into posterolateral surface and posteromedial surface. Now what are the muscles which are originating from the posterolateral surface? Okay, here the posterior surface gives origin to the tibialis posterior. This tibialis posterior lies between the medial crest and the interosseous border. That means posteromedial surface of the fibula on the posterior surface gives origin to the tibialis posterior. Now coming to the posterolateral, okay, posterolateral gives origin to the soleus from the upper 1/4. Okay, this is the soleus muscle from the upper 1/4, and flexor hallucis longus from its lower 3/4. The entire lower 3/4 gives origin to the flexor hallucis longus. For example, again we can see in the schematic representation. So this is the interosseous border, and this one is the posterior border, forms the posterior surface, and this one is divided by medial crest. Okay, this medial crest, this forms the posterolateral, and this one is posteromedial. And in this, upper fourth gives soleus muscle. Okay, this gives soleus muscle, and this lower 3/4 gives flexor hallucis longus. And here on the posteromedial side, what is the thing? So it gives origin to the tibialis posterior. Normally at this side, tibialis posterior is getting originating. So these are the muscle attachments on the fibula on all the surfaces. If you see the borders, okay, the anterior border of the fibula gives attachment to the anterior intermuscular septum, okay, and also superior extensor retinaculum, superior peroneal retinaculum. The posterior border gives attachment to the posterior intermuscular septum, and the interosseous border gives attachment to the interosseous membrane.